It's a warm welcome to yet another exciting Radio Grand Round program. This is a program that talks about nothing but health. I'm Stephen Chongompuku, your usual presenter. Remember, this program is brought to you with the compliments of Lumen TV, and you can catch this channel on channel 101 on the Top Star Bouquet. And it is also brought to you by Radio Maria Zambia, Lusaka, and also Radio Maria Chipata. So be with us, and as usual, I have to welcome on the program my guest, Professor Taxon Lapat. Professor, Mudibwanji.
Yes, and greetings to the viewers and the listeners.
Okay, so remember, at some point after Professor takes us through today's topic, we are going to open the line so that you can contribute to the program. We will interact and, learn more about what the professor has for us in stock. But I can hasten to say we are looking at the temporal lobe. We are still looking at the brain and all that it does and how to keep it, functioning properly so that we can have a healthy life. Professor, greetings.
Thank you very much. May I start as usual? Greetings to our Vice Chancellor, Professor Njelesani, and right now is addressing students, medical students at Mutandwa, the Romani compound, campus? Mm-hmm. Roma campus, we call it, but it is MBCHB. So he's meeting the new students who have started clinical subjects. And I'm greeting him, and of course we have our Deputy Vice Chancellor in charge of research and innovation, very hard-working Professor Mlenga, and indeed our CEO, Professor Peter Mwava, indeed the driving force of the company. And my colleague, Professor John Mdenda, who is the Director of Medical Education, all the deans and all the class representatives who are focusing on academic life of our university. And indeed our registrar, Madam Likando, she's really a driving force, the center of administration. So greetings to them and the students who are listening to this program. And today, as you have heard, Amarumbo is an extremely important central song sung by one of our doctors, graduated at Lamu. Graduated at Lamu and very committed hard worker. I was pleading with her that please, God gave you the talent of singing. You can still sing as a doctor. You can still produce music.
That's
no, she's doing very well. And indeed, there are other lecturers who are very committed, who are good at singing. I'm thinking of the acting dean of MBCHB now, Dr. Teresa Skazwe. She's a very good musician. So I hope that these people don't lose their talents. It's one way of praising God. And looking at the subject of today, temporal lobe, for our students, this is one of the complex parts of the brain. You have to listen very carefully so that when you meet these things in your practice, in your nursing practice, physiotherapy, medicine, Apex, please listen, because you'll be seeing these in your patients. Now, the temporal lobe, to identify it, to locate it, you just draw downwards the line at the superior posterior end of the lateral sulcus, which we have been referring to, lateral sulcus, or Sylvian fissure is the same sulcus which we are referring to, two names, lateral cerebral sulcus or Sylvian fissure. Now, at the superior or posterior end, you draw a line downwards. That marks your temporal lobe from occipital lobe, which we covered last week. Then it is the below the lateral sulcus. Above is in front, frontal lobe. As you go backwards, there's parietal lobe. And then below all that line is the temporal lobe. Temporal lobe. Now, this temporal lobe is so specially located. It has the two major channels of blood supply. I will explain why our students should know that one. Because we see it in patients, but we don't explain it to the patients or to the relatives. The temporal lobe receives two major vessels blood supply. One is the middle cerebral artery, which is the major artery supplying blood. The other one is the posterior cerebral artery, which is the terminal branch of basilar artery. Now I want our students to refer to the vertebral artery and then basilar artery. At the end there is a terminal branch called the posterior cerebral artery to the occipital lobe. But it gives a strong blood supply to the temporal lobe. So two sources of blood supplying the temporal lobe. Now when a patient has suffered a stroke, dominant brain is affected. Like those right-handed people, their dominant brain is on the left. So that's where the speech center is. But that what goes is the motor center, speech center. They can't express themselves. They can't speak out. The speech is gone. But because the temporal lobe has a double blood supply, when the stroke has occurred because the middle cerebral artery has blocked, it's a big stroke. But because of that double supply, the speech center for comprehension, to hear what people are saying around the patient can hear you, except cannot speak back, because the expression has gone. But the comprehension is still intact because of the temporal lobe sparing, because of blood supply which has been spared. This we have to be able to explain to our patients. When a patient has a stroke and the speech is gone, it doesn't mean that it's not hearing you what you are saying. The patient is hearing every word because the comprehension center is in the temporal lobe. That we should understand all types of strokes. Let's not give careless talk in front of the patient because we think he will not answer back. But you are torturing the patient because he's hearing everything you are talking about. So how we handle our patients, especially those who have been right-handed and they have paralyzed the right side, right arm and the right leg are paralyzed. And yet they were using the right arm for writing, for eating. They were kicking the ball with the right leg strongly to score. Those are right-handed people. So their dominant brain is on the left cerebral hemisphere, both frontal and the temporal lobe. And the speech is split into expression and comprehension. That point they should always remember. Then I should also say that the temporal lobe is the center, again, that is involved in emotions, and is connected to the limbic system for our students, emotions. The mood is there. And what is also very important, Mr. Chongo, is the social behavior. We take it for granted. Our Creator gave us part of the brain responsible for social affairs. Socializing. The human beings must socialize. And we are given neurons. Part of that creation was that in the temporal lobe. So social behavior, attitudes, temporal lobe is involved in your attitudes. Just like any part of the brain, the way we bring up children from young age, we develop their social behavior. If in a family they are always fighting, quarreling, and likely the children will follow the footsteps. They will think it's normal. So social behavior, God gifted us with social behavior neurons and also attitudes, but we develop them over the years out of our experience as we grow. But our students in Apex, we teach them to acquire knowledge. Knowledge, they use intelligent neurons from the frontal lobe. You remember that? Yeah. Frontal lobe, that's where intelligent neurons are. Emotional neurons on the medial side, intelligent neurons on the lateral side, the frontal lobe. They interact. All these 4 areas we are touching in the brain, 4 by 4. 4 on the right, 4 on the left. It was a gift from God, the Creator. Human being was created in a special way. Adam and Eve were created in a special way. We must know God. We must know God. And the beginning of wisdom is knowing God. That's very important. Look at the gifts that God gave to the human brain. We have gone frontal, parietal, occipital. Today we are in temporal lobe. So I've mentioned emotions connected to limbic system. We shall touch it again next week. We have moods, moody. If you are bringing children in a moody environment, they will be exercising that. Please exercise happiness. Enjoy life at the family level, especially when you have children around you. Let them express themselves. Let them comprehend what you are talking about. And the frontal lobe express themselves. Temporal lobe comprehend. Make them understand. You are developing, but they should understand good behavior. Then I've talked about social behavior. What about attitudes? Now for Apex Medical University, I was saying knowledge. We emphasize acquire maximum knowledge, develop skills, but above that, we are insisting on ethical professional behavior of our trainees. And we think it should start during the training period. What is it to become a health worker? What does it mean to become a health worker? A health worker will look after healthy people to promote good health. We will work on the prevention of disease prevention. We will work on the diseases when they occur in human beings. So you will handle patients. So we want ethical professional behavior. Our teachers are emphasizing on this, Apex. Every teacher should know that. Ethical professional behavior and the right attitudes. How do you handle patients? Right now, last Friday, we have introduced what we call virtual clinical educational grand round for nurses. Our trainees last Friday, it was wonderful. 4 nurses were presenting to their seniors and the professorial team. It was very good. And we have established that so that during training, we are showing a good example of ethical professional behavior among nurses under training in Lusaka Apex Medical University. Should acquire knowledge, skills, but correct ethical professional attitudes for nursing and also behavior in front of patients. How do you handle patients? So every Friday, 12 to 14 hours, all nurses in the clinical areas, even those before, they should attend the grand round. And we are going to introduce in all clinical activities of our students, like physiotherapy. We shall go and introduce that. Dr. Kondo is hearing me. So we want our trainees to go through this. And I hope it will help. Because when health workers qualify, they should go out and look after God's people. Wherever they will go, they are going to look after God's people. How many of our nurses now have been recruited to UK? They should look after those people there with a high quality and the proper ethical professional behavior, so that they will be saying, where were you trained? You see? So that's the kind of pride you want. We want to produce quality, we want to produce the best practitioners for the sake of service to God's people. Nikambeko mchinyanja. Yes. So nikambeko pashoti mchinyanja, lero bongo tafika hapo ni pamwamba pa zitu hapa, pamwamba pa zitu. Zitu ili linatenga mau mukamva mau yalo wa mkati yapita ku temporal lobe auditory cortex ndiye tikamba pano. Bongo la mkati jalimvera kuti wakamba uyu ni chite. Ing'ombe ya chite yalira hii ni geneti. Timaziwa kumuzi. Walira ni mazuka wala ni nkunzi yatu ija. Yalira ilicha huku. Tichita appreciate fukwa tiviziwa kuti sound yakuti ni yakuti. Mauya haya ni ya chite. Kana mfuma lukuwa pamuzi. Mujwa kuti amfuma lulankula. Bongo ndiye lichita interpret kuyalu lankula lomba ndiye mfumu wanu pamuzi ndimozi kalira. So ndilo bongo yamena kutingati lirandira magazi panjira zibiri, njira zonse zibiri, lomba muntu ngati wazizira kumozi, ngati sale ale pera ukamba, ale kero ukamba, sale pera amvera, vijamulu ukamba ujawo dwala lumvera. So kambanizabu inozo mulimbitsa kutachire uja muntu. Osa tizama nyozo yae, mumchita depress. Ziko
Makwambiri, like always, we are now opening the lines. Remember, this is your program. You can call us from wherever you are. And just to remind you that this is the Lusaka Apex Medical University Radio Grand Round. And we are getting you live and clear if you call. And I'm sure you are getting us loud and clear. The number 0972695200. 0972695200. We have a call. Hello? Hello?
Hello, Mawaka Bwanji.
Bwino Mawaka Bwa?
Sauka, Dr. Lambert Mawaka Bwanji.
Na ukafumu Mawaka Bwanji.
Mawaka Bwino, Dime Vincent Pili.
Good.
From Roma Parish.
Very good.
Nisiwa ufunza kuwa doctor. Nina mwana. So uyu mwana amasha sometimes zitoza agwa akamunda afentako. So tabeta mpeleka ku hospital. Bwana kamba ati kumpima ku brain wala kumpima. Nishi mangwala yanga peze kenezi kuti
and how old?
Ana 16.
16? Okay. All right. Ziko come.
So mafusabu ino maningi mafusabu ino kugwa kulipavili maana kuuzira ni wa dokta wanu anatamba bwino utikapena ni kubreni ngati ni kubreni ni epileptic fit ndio kuti electrical wave ya brain siri bwino ila abnormal epileptic fit koma ngati ni kugwa chifukwa mtima supo mpabu ino usually ni hypotension ni mwana wa mng'ono huyo. So wopima amvetse buno history mwena gwera nanga akagwa ama chitazotana ngati wagwa akagwa pansi paja mnthawi yaing'ono wauka wanyamuka ndiye kuti ni bongo liluchitisa tero libolandira magazi lokwana bwino ndiye kuti mtima ni wofoka supompa bwino uchita supply njira za magazi zija nakamba zija siyabwera yokwanira ndiye kuti oxygen nayo iluchepekera yofika ku bongo because bongo lifunika 4.5 mils of oxygen every 100 grams of brain every minute ndiye quantity ifunika so ngati yachepekera ifika mtima sulu pompa mokwanira anakamba adogota kuti mwina kumtima but numvera ndakaja kupimira nu taking a blood pressure viribanji ngati ni mtima vizapezeka kuli first heart sound second heart sound vienda bwanji opima uja apime nakaja kupimira adokota ngati ni mutu timachita EEG electroencephalogram tione ngati ni petitimo feet or the actual feet partial feet any kind Jacksonian feet. We have different types of feet. So akapimiwe so bwino mwana chifunika ni peza cha chisadzaye kutinjo vichoke mnyanga acheva natero
ichoke mnyanga indeed. Okay, we have another call 0972695200. Hello. Okay, you can try that again. Dr. Pali lead wananuza tini wafunsire kwa program. Baina baby ina 7 months, but mukosi woneka su kadbeno kosa na manje. What could be the
iyo tiwode intracranial pressure 7 months ndio utili wombo likalipo chifuniko upimi wa mwana uja aone kuli masiku yano Apex number department ya ultrasound ni machine ilongoza zichitika mbongo ulongira pa window paja pali wombo paka ruchaya 7 months paka ruchaya ya kufranti icheka pa 18 months ya kumbuyo ndio icheka pa 9 months so apite naye akapimiso ona ziruchitika mkati mbongo.
Okay. But imankara kona corrective measure?
Yes, depends on what is causing that weakening of the neurons to support the neck muscles.
Okay. All right, we need to get that call. Hello? Okay. All right, you can call again 0972695200. 0972695200. That's the number. But as we continue getting those calls, Professor, mwezi mwakamba kupama emotions, mamudi, majani. Ngawaja wameno wakamba jawa ina bad temper ni chanchi machitika.
It's the control measures inside the brain. As you can see, tempers can be controlled. For example, if the intelligent neurons control the emotional neurons, tempers can come down. Before you say anything, that's why knowing God is extremely important. Before you respond to anything, you react, please say that what you wanted to say should always glorify God. You will never be temperamental because you are controlled. Everything was provided in the human brain. We can control behavior, anger. You see, temporal lobe can also control what is going on. I've told you that the main activity is what we hear. What we hear can trigger a reaction. But even at that level, we have to know how to handle it. The brain is interacting. Internal consultation. How do I respond to a situation like this? So tempers can be controlled. But if you grew up in a family where any differences end up with carrying a club and hitting each other, your response will be more like an instant response. Like because that's the way you have been brought up.
Okay, reflex.
Yes.
Okay, we have.
But by the time you realize you have already done something wrong.
Damaged the thing. Hello? Hello?
Halo.
Yeo.
Ziko mwana mbese satari ansa nani pasa Dr. Ambadi munga wa Darise.
Ewo.
Nizaisha vane wakamba munga wa Darise mpensewa wasinge upamasuzi ya kuri maningi.
Oh, thank you. I like that prayer. Thank you.
Nasambi shira kwa mwazi pasinda mkonto village.
Ni mapa mkonto? Mama, ninaru wetera ngombe pachani ya pachitambo kupamuzi.
Pepa. Tizi wako ndiyo kwa kikuja.
Niziwa.
Ziko ma doctor.
Ziko.
Okay. Right. Wakumana wakumuzi kumoja. 0972695200. That's a power line we're getting your calls on. Professor Mambera Bwino waku Eastern wakatuma wakuchipata kwa Mambera ku Radio Maria chipata tiembekeza kuti mutume mu.
Yes. And it's Natsegula Apex Center in chipata.
Okay, we have another call. Hello.
Hello, watendo maruka sani.
Twashubuka Bwino mwashubukeni.
Atiba?
Achani wana wala ileta ponchta imbi.
Na ukamai mwakaba?
Ulitima kada wababa mwenye mkana ubaba. Anga mkima wababa mwenye kwa kubongo, mbele ya kubongo.
Aha. Mwachitabu inofunsa haweza mbili uwawa ngati mtima uwawa mumvereka ngati mtima uwawa ku left side of the chest uwawa na left shoulder uwawa mtima sululandira magazi okwana mawambili mapatient ni angina pain. So magazi siyarufika mokwanira kumtima muscles myocytes ya mtima siulandira magazi yokwana. So muende msanga kuchipatala bamvere azamupasani mankhwala yotsegula njira za magazi yopeka kumtima uwawa kuja kuzata.
Ziko mkwambiri 0972695200 ndiye nambara ya mene munga tume. Hello.
Hello mwakabanji.
Bwino mauka.
Tauka
Yewe.
Ndine mwale wana.
Very good.
Nima shanga chiniye ndakako nima mvera chizueze pamaso na bili nishini chani.
Aha.
Ngati mwenda? Okay, ziko
ngambi.
So ngati muntu alikale ola aligone waimirira amvera chizwezwe, most of the time ndeuti magazi yalibofika bwino kubongo, yalibofika yokwana. Ngati waimirira luyenda dopa amvera chizwezwe, blood supply ya kubongo ti checking. The dizziness because of hypotension or failure to supply enough blood to the brain. So paja brain ifuna muntu agone pansi. So akagona pansi izalandira blood yokwana. Ngaona akagona pansi paja very quickly ayanganuka bachoka bonse picha. But also brain source itself jenda kamba kutinga tifuna tione chilu chitika ijanthawa walumvera chizwezo apite kuchipatala apimiwe na EEG machine ingalongoze vilu chitika. 2 apimiwenso mtima ECG na echocardiogram. ECG niwona electrical activity of the heart muscle, and the echo is to see how the chambers are pumping the blood. So vonse viwili apimiwe bongo na mtima umene.
Okay, 0972695200. Hello.
Hello, mwakabozi.
Bwino
Tauka.
Mwakabozi ya doktor.
Nauka mfumu mwakabwani.
Mwakabwino. Ndile mwe ntumira kuno ku Lusaka Kabrenga.
Very good.
na first find out nayo mama ndio asiye ni hivi kama tunaweza basi na problem sobeo ndio na advance
weightlifting
weightlifting.
Yes, okay. Wazaka appetite. Imapasapi. Niche ndivinizi wako.
Yeah, no, it's a very good exercise. When I was in secondary school, Form 2, I was a weightlifter as well.
Okay.
Katete secondary school. Mnapita kwa Katete?
Napita moja.
Muri
maningi.
That's one of the most beautiful districts in the country. So weightlifting is good for your exercise. You are building muscles. But as you grow older, the energy, you have to match with it. Don't force the body to lift things that really will strain your spine. Why people are saying, if you take x-rays for people in Lusaka, the same number of people, and you take x-rays of miners on the copper belt, after years of mining work, you find the spines are different because that heavy work strains the spine, so they tend to develop spondylosis. So the tendons, that's why they are warning him. It's true, but as you grow older, match with your age. Don't overstrain. And always check your blood pressure, because that straining increases more blood pressure. The older you become, we should know your blood pressure. The same, Mr. Chongo, to be blunt, even sexual activity. The older you become, the more careful you should be. And you always know your blood pressure, because sexual activity increases blood pressure. Just as that weightlifting, heavy weights, blood pressure goes up to match with the muscles getting blood supply. So if your blood pressure is not checked, that's why you say blood pressure is a silent killer. So there are people who have developed strokes right in the weightlifting rooms. So we should be careful. That's what I wanted to say.
We should be careful indeed. Remember, like I said, we are getting us loud and clear. Actually, we are live on TV, Lumen TV, Top Star Channel 101. So for those of us who have that, bouquet, you can visit that and go to Channel 101. We are live. Wanachimba mune wino TV nango muchaika ka payment ka ngatamwali pira mulipiri. Okay. Also in Chipata and Lusaka, I'm told we have a call. Hello, caller.
Hello.
Yes. I'm Dara. Zile
na kabanji
Tauka mfumu mwakabwa
mbegezani izimiani chilimba boss. Hello, Shimeni Chilimba.
Okay, nifuwa kuchilimba.
Chileo mfika ekwe. Hello? Mwaya kuisa nomba.
Na pansi nini?
Okay, landeni.
Kukula kwanji. Kuna nini kisha posta ina ngalifi na kwa hiyo kisha kutoba na bloko na kwa bloko jini kukula na yanda kundi fi folo kucha kukula na gadi ni fia so kwa nini kisha kukati ni 46 years hapa so hapo na pale tani ndani hapa kwa hapa na itakufa yanapokuwa chini ni kula baba kama devil ya kuna sare mfotofika nenda pale pa 46 hapo nenda na tapu kwanza na hapo.
Okay, I think we've gotten the gist of
yes. He's a hard-working man and physically hardworking.
Very
good.
Age is catching up.
Yes, the age is but he's a young man. 46 years, very young.
Babanje tukuta fast.
Mkudia. Okay. So what we need when we finish central nervous system, Wachongo, we are going to musculoskeletal system. So Buru watu tiwauzi listen very carefully when we enter musculoskeletal system, because all these will be explained. Most of them, But like kwatu, they will say nyamakazi, nyamakazi, nyamakazi. It will come out when we are handling musculoskeletal system. So I think for today we are concentrating on the brain.
Okay, 0972695200. Hello. Okay. Okay, chawa mamule tamba. Chawa mamule. Bye bye. All right.
Yes.
Wezoaika ku channel winangu. 0972695200 ndiye namba la mene muri kuti besera. Now, if speech is lost, mwambente sakamira ngati muntu ina problem ichi. Can it be recovered, or how damaged is the system that it can't allow the speech?
Some patients will recover. Now there's one request that I give to the listeners. If somebody has a stroke and has lost his speech, usually it's expression speech that has gone. But those neurons are very close to the neurons that make you protrude the tongue. If you are a patient that lost speech and ask him or her to say, can you bring out the tongue straight, and is able to point out the tongue like you are doing, Mr. Chonko.
I'm trying.
Yeah, you are trying. But your neurons are intact. So if he's able to do that, we always say there's a possibility that he will recover the speech, because the neurons are next to each other. By the way, when there's such a damage, it depends on how many neurons have been damaged. These are terminal neurons, they don't recover, but the neighboring neurons, neighborliness, love your neighbor, the neurons, they start taking over the dead neurons, the functions, and they create more dendritic connections to cover. So lucky patients, they start now coming words and start talking. It may not be perfect 100% as it was before, but they do recover, the lucky ones.
All right, someone is calling Professor.
Calling me directly.
09726952.
Can you take away the phone?
Okay, the floor manager do justice to that. Okay, 0972695200. If we have a call or not, we'll be continuing with our discussion with Professor. But mungatume pa 0972695200. Professor, as you grow old, be careful. Maybe in a beeping at your my exercise and voice shooting. Now, bantu people that okay to my exercise to funikako.
Very much.
But how do we, an old person, exercise, or muntu aina BP maning exercise the heart?
They usually advise walking. For example, walking is very simple. Walking, even in the house, you can be using your legs. Recently, there was a write-up saying that diabetes, sugar control, you can use your calf muscles and reduce blood sugar. Meaning the activity of the muscle will help you use the sugar in the muscles and start lowering it in the circulation. These are recent observations. So walking elders should be walking. You find in Europe, people walk freely. You know, couples are walking along the road. I think we see our colleagues, the white colleagues, they do walk, husband and wife, along the street. You haven't seen them walking? Either. That is an exercise. So certain activities in societies, we should learn from each other. No? Not always indoor. And the wives are pinned down and locked up indoor. It's not healthy. But to walk around, do indoor exercises. The blood, the muscles, they require activity.
Okay.
Yes.
0972695200. We are waiting for that call. We seem to have one. Hello? Hello?
Hello?
Good morning.
Madam Ben.
I'm quite.
That's what I talk about, doctor. I'm not more about shower man in a 30 days.
Good.
Sometimes you know, some Simasia, later, you can have Sunday and later, you can last week. Egyptian. So, Papa, when I got a chance to correct Egyptian, teach which they go to and the solo at Rema, Wakalita.
Blood pressure and with the bar.
The taking 168/111.
It's very high, my dear. Let me explain. You know, she sounds a young lady.
30 years.
30 years, she's very young. Her blood pressure should never go up, the top one, should never go up 140. No. 140 is the maximum. In fact, her upper blood pressure should be 120, the best. 120 will be a very good one, but it can go up to 130. But at 30 years, you are going to 160 something. That's too high. And the diastole, her diastole is above 100, 110.
Says, yeah.
This is typical of hypertension. She needs to be admitted, to say the least. She should be treated even for 2-3 days as an inpatient to control the blood pressure. Then discharge her after clear health education of what blood pressure is and how to keep it normal. That explanation not just pleased my fellow practitioners. It's not just prescribing medicine. We should explain it to the patients. This lady is walking in a very dangerous zone. The heart is warning her. The heart is saying, your blood pressure is very high. Me, the heart, the muscle, I'm not comfortable. And even blood supply to myself, the heart, is getting less. That's why that warning pain is angina pain. Instead of just treating the angina pain, we must control the blood pressure. Please, she should go back to her doctor and explain.
Wambera amai nkokchawama, that is not good. Just go tekumitinya but kumya kuti mo yanganepo pa health yo, and then your BP is very high, especially for your age. We have another call. Hello. 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 Hello, caller. Okay, we seem to have lost that one. You can call again 0972695200. Hello. Hello. Okay, call again. You lost that one. 0972695200. Another one. Hello. Mwafika mulipa radio amai. Hello. Okay, watu mabati wakapa ku background na vinangu. Zati uzako vakunyumba. But you are parade. Hello, 0972695200. That's a power line. You are getting us on. We have another one. Hello.
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 Yeah, Dr. Maukabwangi.
Tauka mai mwakaba?
Tauka, Dr. Ninapebe mkuu. Nikamama na kutiezi, but mumara kate material tisayamba. Kutoka kabati every month. Muwa abakuita mumara segura na kuni.
Nanda hospital mnaendako?
Hospital ninaenda kwa kukoparete manje kuona kuti kwa tena kulima ngarako sana ya scanning.
Makambabu no scanning ifunika maningi, but pali zintu ziwiri ngatana 30 years saenda buno kumpepo kuli mahomoni amene tipima. Mahomoni ya kubongo, mahomoni ya kuovare tima pima. Ngati ni operation alukamba kapena ni DNC, I don't know, but choyambirira nupima mahormones, ma estrogen, progesterone ya pangika bwanji mkati makamaka estrogen. Na estrogen mwezi na mwezi iyenera opangika kuti pange tumbo kukhala mwana kuja ku uterus, so that pakapita nthawi ngati alibokhala pakati apite kumphepo ndithu. Azapima mahomoni, then apime maovari amene, then apime tumbo kukhala mwana jati kuti uterus mchizungu. Vonse vipimiwe. Musazengereze mwana alukula 30 years wakula mwana. No, mkaende kuwaene clinic kwa gynecologist. Mkafunse ngati kokusowani mutenga second opinion ozati khalire pamodzi na pamodzi zakazilupita. Ni health ya mwana hiyo.
Ziko makwambira mai, we are slowly getting to the close, but we have a bit of some time. We can continue getting those calls on 0972695200. Hello? Okay, again, redial that number. You'll be live on radio. Hello? Yeah.
Hello, good morning.
Good morning, ma'am.
I wanted to find out, doctor, what causes heart palpitation, and sometimes you really feel the pumping of your heart.
Yes.
That's what I wanted to find out.
Very good. Now, heart palpitation, if you are feeling it, is a symptom. Sifuniko mveka.
Mchima sifuniko mveka.
Ngatulumveka aija maopa something, then mtima rutamanga fast ungamveka ogunda. But when you settle down with your hair, but siyo nero mveka. So chifunika monga wakamba so. Osa kazigira makamaka ngati palpitations without exercise alumvera mtima omenya heart palpitations. It's not good. They should do an ECG urgently. Then in combination with the echocardiogram. Now the heart is trying to show something is not right in the circulation.
Wow.
That's what it means. But somebody must listen to the heart. The first heart sound, which is the closure of mitral and the tricuspid valves. They give us, that closure gives us the first heart sound. Yes. Then the second heart sound is when the chambers have pushed the blood. A lot of blood goes through the aorta, and then the aortic valve must close. Some blood from the right chamber goes to the lungs, and the pulmonary valve must close at the same time. That gives us our second heart sound. So we have systole in between and the diastole phase between the second and the first heart sound.
Yeah, okay. We can get some few calls between now and the time that we are closing. 0972695200. Hello? Okay, 0972695200. That's a power line that you are getting us live on. We have a call. Hello? Yeah.
Kauka mai mwakabwa.
Kauka bino.
Inde.
Pamono.
Aha.
Adokta ile nilinane niliko na problem. Nikaja chabe sima nikaja. Nikatakuja. Nikuweke mula dokta nizankala oro 30 minutes niweke mula. Na biti nayo iseruka irukwera kwera.
Ya siviri bino mtupu yetse mula ni mhuno umo mulima masai na sezi yamina chita drain mhuno andi mzaona yetse mula kuja kuchogoro kuna botosa magazi ajati kuti epistaxis uchosa magazi mpuno vonsevo vuto lili nalo lali kulu ni blood pressure yanu sina kare controlled And I don't know, we didn't ask how old she is. But please, blood pressure yo ingaononge njira z'amagazi. Mutu mamene, mphuno, bleeding, we have littles area, mphuno, ingachose magazi. Wetse mula kuja, tichekinyeso sinuses ya libanji mphuno mulibanji. But blood pressure ikale controlled. Both systolic yapa mamba na diastolic yapansi. So I'm insisting on that. Our apex medical students generally, they should understand there's the systolic part and the diastolic part.
Okay, 09726952. Can get two more. Hello. Okay, 0972695200 as we wait for that call. Nezo kama nazamfunsan kon pamamudi na going by what you were explaining. Nga ma personalities ya jamino kama extroverts, introverts. Has it got anything to do with those?
So personality largely is in the frontal lobe, emotion and intelligence. So it is a relation. There are people who are brought up to feel they are very big, they are strong, they want to be the ego, super ego.
Dominating.
There are those who are negligent of themselves. They have no drive, nothing. But the majority of people are in between. So the way you have been brought up, the way your mindset is. But as you can see, we talked about mood in the prefrontal. We have talked about mood in the temporal area. And even in the parietal lobe, what you receive from outside can also affect your personality. It's the way you handle things.
Okay.
Yes.
We can now get the last call. We had a call. I think I should presume. Hello. Hello.
Hello, Morabon. But doctor, you can have problem. You can have Dira manindi kunabela. That is too much.
Kind old? 4 years. Okay.
So, akajiblende kajenengela ngepandika nafuza. Ndikese kwendele ku clinic atendele ku x-ray mpima chao ku get the millions. So wangeta beka just medical pina mumpere ku operation.
Operation ya.
Yeah, child.
No, let me explain. You see the testicular, isn't it? Pain. Mumvere romba.
Katingani mumvere.
Mumvere buno ready. Ma testis. That's why amuna tizia mika azimai. Ma testis yapangikira mala. Mimba. Loin, area where the kidneys are normally are. So but before delivery, in fact, 10.5 weeks, my testis started migrating down to the scrotum. Lombangati alipofika pa time of delivery, pa 8-9 months, yanera kutia fika scrotum ya gwirane kumtumba la scrotum, gabenaculum. I think our students are remembering. And the testis position should be vertical. Now many people don't examine that, unfortunately. The testis must be vertical, not horizontal. So ngatisiri vertical, ima current twisting, ndeja current pain. The danger is one day, ikachita twisi, yachoka, tukafa tonse tumabola tungafe pantawe mo. Because of recurrent twisting. So muntu azakala ukanga wakula lomba sanga kalena wana yufukwa matestis anaonongeka because of recurrent twisting.
So kutest amina wanga
ufuniko pima kapime wambisa pima but pima uone position ya testis wawa both sides, right and left. And there's an operation we do. We do what is a 3-point tie. So that testis is a much that twist. Okaidopexy is the name of the operation.
Wow. Okay, we have run out of time, Professor. Under a minute to do your conclusions.
Well, thank you very much. Just to emphasize that we are still enrolling at Lusaka Apex Medical University. May I thank the listeners. You have really been our ambassadors. This year, the number of new students has increased. It has really gone up. And we thank you, listeners, because I think you are passing good message. You want your children to come to Apex and become health workers who work for God's people, humanity at large.
Okay.
So the enrollment has gone up, but we have extended. We are going to stop enrolling on the 14th of February. But the grade 12, those who have results now, please let's encourage them to come so that they start training as health workers. It's better they finish early before they start other things. They have already qualified as professionals.
Professional doctors. Right. Thank you so much, Doc. Do you have in mind our topic for next week?
Next week we are going now to deal with memory. It's the same temporal law.
I need to pay attention on this.
Yes. Recent memory and the storage system of the memory.
Wow.
A lot of people will start wondering, but a gift from God.
Yeah. Thank you. Right, we've come to the close of the program. It remains for me to thank you, our dear listeners and viewers, for following us and for participating. And we thank everyone behind this production. We can talk about in the studios here. We have Mr. Sydney Mwamainda on the controls, and also Andrew Sichone, Kandu Agnes at the studios at Lumen. We have Esther, Messi, and Natasha. We also thank our executive producers, our two priests, the three priests actually, Father Kunda, Father James, and Father Lungu in Chipata. I'm Stephen Chongompuku. Enjoy the rest of the programs and stay healthy. Professor, thank you.
Thank you very much.